This happens to be my better half. I've been honest in capturing her data, and she's around 59 with a host of illnesses, a known case of obesity, osteoarthritis, hyperuricemia, lower limb varicosities, fatty liver, and hypothyroidism since past 10 years. And she developed type 2 diabetes 3 years ago, fairly controlled with a fixed dose combination of voglibose 0.3 milligram plus metformin 500 milligram twice per day with major meals. So this voglibose is another commonly used agent which is supposed to address post-food elevations of sugar. It should be able to correct those. And luckily, she doesn't have a history of hypoglycemia, hypertension, or any of the cholesterol abnormalities. And she happens to be under regular guidance and follow-up of a registered dietitian and a qualified diabetes educator. We have one of the most prominent registered dietitian and diabetes educator coming up after me to deliver an opinion. So physical findings I've clocked prior to and 3 months after starting green jackfruit atta. So you can, I think I will just look at the weight. She's lucky, I'm very happy. My wife is becoming slimmer, 89 kgs from 92. And a BMI has marginally come down to the obstetric height. And these are some investigations and sonography findings before and after 3 months of green jackfruit atta use. So fasting sugars have come down from 110 to 99. These are all real data, nothing, at all manipulated. These are real data we have on record in our phone. PPPS 176, that has come down to 151. HbA1c from 7.9 to 7.6%. She had fatty liver grade 2, I'm coming to that, and because of that, she had SGPT elevations. That 66 international unit has just touched upon the normal range. 45 was the cutoff for this lab. Uric acid, while she was on febuxostat, 40 milligram after dinner, that's a molecule to be given for correction of high uric acid levels. So that had been 5.6 prior to start of green jackfruit atta. It came down, luckily because of perhaps improved overall metabolic milieu. It came down to 4 milligram per deciliter. And at this point of time, I decided to give her a drug holiday. So I put her off on febuxostat. And creatinine, that is the kidney function test, and eGFR is the amount of urine formed by our kidneys every minute. Those were all within normal range both the times. Regarding her thyroid, she was on maintenance dose of 100 micrograms. She continues to be on the same dose. And thyroid function was unaffected. Her LDL, HDL, which luckily she has for her host of comorbidities, good HDL, above 50 both the times. That's a cutoff, desirable cutoff in females. Triglyceride came down again by a substantial amount, 21 milligram, 19 milligram. Fatty liver grading by a qualified sonologist was to my relief. It came down from grade 2 to grade 1. So what are the learnings from these two persons with diabetes? So how green jackfruit atta really helped these two individuals. They continue to use the green jackfruit atta and they are doing well. The addition of this nutritional gem helped correct the fasting sugars, postprandials, HbA1c, lipids, and fatty liver in my wife's case at least. And then it induced marginal weight loss, improved quality of life. So what is the scientific basis? I'm coming to the end of my presentation. Nutritionally, 30 gram of green jackfruit atta gives 108 kilocalorie. Net carbohydrate content is around 20 grams, and dietary and soluble fiber, to which Dr. Khoshla madam repeatedly referred to. This very important component. Soluble fiber 4 and dietary overall fiber of 4 and soluble fiber of 1 gram. Compare it to the placebo atta, which could be rice or wheat, which was found in either case to contain 146 calories, higher carbs, lower dietary fiber, and 0 gram of soluble fiber. I think Dr. Khosla Madam very repeatedly highlighted the importance of soluble fiber in management of diabetes and our day-to-day metabolic milieu, including our, she referred to a very important gut bacteria part, which is outside the scope of today's discussion. 3 phytochemical ingredients, including vitamin C, which is ascorbic acid, beta-carotene, and lycopene, which have been found apart from a host of incredible amino acids and good things found in the green jackfruit atta, shared by Mr. James. These were found primarily responsible for the combined antioxidant and anti-glycation. So glycation is a process whereby bad things happen in a person with diabetes. So these ingredients confer a win-win situation for green jackfruit atta. And clinical trials conducted at Sydney University's Glycemic Index Research Services have found that raw jackfruit has a much lower glycemic load. So there are 2 terms. Glycemic index just gives a numerical figure and says how rapidly a given food can increase blood sugar, but how much that increases is done, both the functions are done by glycemic load. So I think I would leave it to Cheryl to, if at all she wants to have a comment on this glycemic index and load. We can replace, so in my final comment, we can replace a third of rice from our idli, dosa, appam, puttu, etc., and a third of wheat from roti, upma, puri, aloo paratha, etc., by green jackfruit atta, and we won't notice any difference other than a very positive change to our health.